I should probably give a little bit of background about the study itself. We were very much interested in looking at people who are living with an indwelling urinary catheter in the community. Now, there's a range of people that need this device for a variety of reasons, but we know from the literature that there are a number of problems with these devices that can arise. So what we wanted to do was to look at the education and training of staff who were supporting patients who had these devices, but also look at the information that was available to the patients themselves and their carers to see how that could be used to improve the life of the patient. First of all, we have developed an information leaflet for patients and their carers. Now that, I hope, is going to go into use very shortly. The reason we focused on that was that the information that came back from the patients, the carers and the professional staff was very clear. There was plenty of information and education available to professional staff, but that was not the case for patients and their carers. So that was a very obvious focus for us moving forward. So the patient information leaflet is already prepared, and that has been written based on the evidence from the participants in the study. So it's evidence-based, targeted at the problems that the patients themselves have told us they come up against. The study that was funded by QNIS has led to a number of other initiatives that we're just starting to look at. So for instance, we're hoping to follow on and evaluate the patient information leaflet within the service. So look at it after it's been in place for probably at least 6 months, and to see whether or not that has impacted on the call-outs for urinary catheter issues. The other thing that we're hoping to do is to look at the possibility of a trial on washout solutions for catheters. That's something that we're taking up with the Health and Social Care Partnership in West Dunbartonshire, the University of the West of Scotland, but also with the University of Stirling and Glasgow Caledonian University. The third thing is we have a PhD student which is with University of the West of Scotland, which is funded by the university and also allied to the project. So there are a number of projects which are coming off this project, which was funded by QNIS.
People at the heart of this project are people with learning disability who have also got a mental health condition. That could be depression, schizophrenia, bipolar disorder. It could just be really just generally stress as well. And I think certainly we were aiming to pitch this project at people who are affected by stress and how that affects their mental health.
The important thing for us was seeing how people with learning disabilities began to interact with the materials that we were showing them. And we had other people from the multidisciplinary team that came to help us. We had physiotherapists come to do about activity. We had occupational therapists come to talk about activity, in meaningful activity. We also did some interactive work around healthy eating, and the amount that they contributed to the process was amazing, and what they took from it.
The best thing about being involved in the project has actually been a bit about the ability to kind of link up with other allied healthcare professionals, to be working with individuals with learning disability and their families. It's been about this collaboration that we've kind of all pulled together, and although everybody's had their own individual goals within that, it's been kind of like a group, quite a sense of feeling in being together on the same journey. So it's been very journey-led, I think, for everybody.
We learnt a lot from doing the groups, and we learnt a lot from the people talking about what they'd learned, what they'd found difficult, what they were going to go away and use, and maybe the things that they weren't going to go away and use. And that has enabled us to work closely with other colleagues within our service that are looking at developing accessible information around wellness planning, around crisis intervention, to be able to take what we've learned from our evaluations and how that will fit in with the work that they've been doing. And we're hoping to progress that to developing materials that are accessible for people with learning disability, but also having it out there for family members and for carers to be able to look at the documentation and use it to help people stay well when they have a mental health condition.
People at the heart of this project are really our patients, and that's men and women who are detained within police custody, and we provide health care to those men and women whilst they're here. Right at the heart of that is the fact that they are quite disenfranchised, marginalised people in society, and as such very vulnerable. It was really hard to facilitate referrals to ordinary agencies, even low threshold agencies, because there's so many rules of engagement that I wanted them to have that opportunity. But it was a Sunday afternoon, and the services that I had identified that would be able to help this process, buddy up, etc., didn't work on a Sunday. So ergo, we have a need. The whole world is talking about health inequalities, working in silos, joining up care between social care, health care, third sector, difficult to reach people, etc., etc., etc. So why not move that agency into here on a Sunday? And it was a really simple hunch. From Sacre's point of view, there were a lot of hard to reach people that hard to reach because they didn't really want to engage, but they found it much easier within this place. So lots of well-kent faces, as the police say, who are finally engaging with real-time agencies. It made it meaningful. And what made it extremely pleasing for us was when people came into custody and started to ask for Sunday choices. And that was within a 12-week period. So we know it's hitting the spot. Because we try to be person-centred in everything we do here. Because even though environmentally it's a punitive environment, as a healthcare organisation, we want to be person-centred. So if someone's asking for the service within such a short period of time, we're onto something for sure.